Hi, I'm Ruth Werner, and it is my pleasure to welcome you to this little piece of the ABMP Continuing Education Summit all about lymph. And you may be joining us live on Tuesday, October 25th, 2022, or you may be seeing this recording at another time. In any case, I'm very glad that you're here. So here's our plan. Our plan is that we're going to do an overview, sort of a helicopter flyby of lymphatic system structure and function with a tiny bit of information about lymphatic system pathology. But we wanted to put some special focus on the lymphatic system problem or dysfunction called lymphedema. And Megan Belanger is a lymphedema specialist, and so she was much more qualified to bring that part of our presentation than I am, and I'm very, very grateful for her being part of this. And again, our purpose in this is to help you be prepared for the rest of the presentations in this wonderful continuing education event. Before we go any further, I want to take a moment of appreciation because much of what I am about to present to you, I have just recently updated and brushed off and come away with a wonderful new appreciation for how terrific the lymphatic system is, thanks to this resource. This is a textbook, Applied Anatomy and Physiology for Manual Therapists. It's a terrific AMP book written specifically for people who touch people by Pat Archer and Lisa Nelson and published by Books of Discovery. So if the way I am organizing our information today works for you and you like that approach to understanding things about how the body works, this might be a book that you would like to look into. Before we start talking about lymph, there's a couple of things I want to do. We're going to actually begin this class by going on a tangent. And I know that doesn't bode well, but trust me, this is not my first rodeo, and there is a reason. What I'd like to do is to talk about interstitial fluid. Interstitial means between the cells, and the area between our cells is often called the interstitium. So in school, you might have learned this as interstitial fluid, or you might have learned it as intercellular fluid. It is represented in this picture by everything that is sort of this lovely light blue. Now, these hard-boiled egg-looking things with the purple yolks, these are, of course, tissue cells. So we have fluid inside the cells. That would be our intracellular fluid. And we have fluid between the cells. That's our interstitial fluid. And then the other big source of fluid in this picture is here inside this cardiovascular capillary. It is the plasma. So in order to talk about lymph, I like to go back a step and talk about interstitial fluid and where it comes from. Interstitial fluid is the product of what happens when these cardiovascular capillaries, where the plasma is, get very, very, very tiny. You will remember that we have the great big arteries, and they get smaller and they become arterioles, and they get smaller and they become the capillaries. And it's at that capillary level that we have our nutrient waste exchange, right? Our blood is dropping off a boatload of oxygen and nutrients, and it's picking up some waste products. So there's a lot of exchange between the interstitial fluid and the circulatory or cardiovascular capillaries out here in the cellular level. What is sometimes not really explored very much in massage school is that also at this capillary level, plasma is squeezed out of the circulatory capillaries, and that fresh, new, nutrient-rich plasma bathes these cells, the tissue cells. Now, most of the volume of what is squeezed out of the circulatory or cardiovascular capillaries, most of that volume that's squeezed out here at the cellular level gets sucked back in. Most, but not all. A little bit gets left over to become the new, fresh interstitial fluid. And so we have this accumulation of more and more fluid between the cells. And if that keeps going on, what happens is the cells get really packed and separated by the fluid, and the blood gets thicker and thicker and thicker, right? Because it has less and less and less plasma. That's a problem. One of the purposes of interstitial fluid is to be a really good medium for diffusion, right? So those cells can be nourished. But remember, there's more left over than gets picked up. And then with the next heartbeat, there's going to be more that's left over, and then more that's left over, and then more that's left over. What we need is a vacuum system that will do this. We need a wet, dry vac that's going to come in and pick up excess interstitial fluid and all of the garbage, all of the waste products that accumulate in that excess interstitial fluid, and process and clean it up and eventually dump it back into the cardiovascular system. And of course, what I have just described is the lymphatic system. So in this picture, I really love this picture. This is a really nice representation of the relationships between the cardiovascular system, represented by the heart and the red arterial side and the blue venous side, and then the green bits, which represents the lymphatic system. So what we have in the lymphatic system is a one-way road. Fluid in the lymphatic system only travels in one direction, and that is toward the heart. And a fair amount of it travels every day. 3 or 4 liters of fluid travels through that lymphatic system to the heart to be replaced back into the circulatory system every day. And so if you think about this as a typical liter of water, about 4 of these, 3 to 4 of these, get sucked through the lymphatic system, through all those filtering stations, and dumped back into the superior vena cava, or actually it's the subclavian veins, but then they go into the superior vena cava, which of course then goes into the right atrium of the heart. And in the process, what's happening in that green bit of this picture is all of that fluid, that interstitial fluid, which gets sucked into the lymphatic system, gets cleaned up, it's filtered, debris is removed, pathogens are removed or neutralized if everything's working well. And so this nice, lovely, cleaned up fluid ends up being replaced back into the cardiovascular system. Another really interesting aspect of the lymphatic system that no one has ever satisfactorily explained to me is that it is so extremely asymmetrical. The lymphatic system is bizarre. 3/4 of it, the lower extremities and the upper, always forget, the upper left quadrant of the body drain into one sort of collection system of the lymphatic system. And then the upper right quadrant, and which includes the upper extremity, the thorax, and the head and neck, drains into a different drainage system on the right side of the body. So we've already set the stage for this part of our discussion, but I think it's worth emphasizing. It makes a big difference. Our body has a water cycle. We have water with stuff in it. It's different kinds of stuff depending on where we find it, but we have water with stuff in it within the bloodstream. We call that plasma. Water, then it gets squeezed out at that cellular level, that I mentioned at the very beginning of our talk today. You will recall that once plasma leaves the blood capillaries, we call it interstitial fluid. Once it goes into the lymphatic system, we call it lymph, and then ultimately that gets dumped back into the cardiovascular system, and now we call it plasma. Again, we have our own little internal body-wide water cycle. So where do we keep water in our bodies? Where is the fluid, our water with stuff in it, located within our bodies? About 2/3 of all of the liquid, or all of the fluid in our body, is inside our cells. It is intracellular fluid. And let's remember that intracellular fluid can come and go depending on the permeability of those cell membranes. But healthy cells have a certain amount of fluid, and we call that intracellular fluid. And about 2/3 of all of our juice is kept inside of our cells at any given moment. And about 1/3 of our fluid is extracellular, and the extracellular fluid compartments are these. It's the blood, it's the interstitium, or that interstitial fluid, or it's in our lymphatic system. So let's ask this question now that we've set up all these ideas about a lymph water cycle in the body. When we ask this question, what is lymph? What do you think is the answer? I should have spelled this out here, fluid becomes lymph. It changes its name and becomes lymph when it moves into lymphatic vessels. The definition of lymph is fluid found within lymphatic vessels. What is it? Well, it's water with stuff in it. But what's the stuff? That is an important question. And the composition of lymph, which is water with these things in it, will vary quite a bit depending on where one is taking a sample. One of the components of lymph is proteins. And I have given you here a little hint. We should not have a high level of proteins in our lymphatic fluid. When we do, when we accumulate a lot of proteins, say, between the cells in interstitial fluid, and then that gets sucked into the lymphatic system, this is an indication that something may not be going well. And you will hear more about that later. When we take lymph samples, we also find cells. We should find cells. We should find a variety of white blood cells that are using the lymphatic system to travel and create our immune system responses. We might also find some dead cells that those white blood cells have eaten and spat out. Lymph may have foreign substances in it. That's especially true, say, of lymph that we might collect from around the lungs when we inhale little tiny bits of dust or dander or skin cells or lint or other things that are suspended in the air. Let's take a nice deep breath and do that. Good. Got a nice big lungful of lint. The lymphatics in our lungs will pick up some of those foreign substances to prevent it from getting any further into the body, and we will be filtering those out, and I'll talk about how that happens in a little bit. And then finally, and you might remember this from a million years ago when you learned about the digestive system, the lymph, especially in and around our gut, has a very high preponderance of long-chain fatty acids. So you will remember in your small intestine that you have all those little intestinal villi, right? We call this anatomy bobblehead, intestinal villi, right? Sure, Ruth. And each one of those little villi, singular is villus, each individual villus has a little lymphatic capillary in it called a lacteal. And it's called a lacteal because the stuff inside them looks like milk. Well, the stuff inside them is fat. So when we digest food into a form that we can absorb, and absorption means it gets into the blood circulation or into lymphatic circulation, but our fats get routed into the lymphatic system. And so those long-chain fatty acids are the products of digestion. It's what we pull in and absorb from the food that we eat into the lacteals, and then they carry it in deeper into the lymphatic system. Eventually, those long-chain fatty acids are going to dump back into the plasma, interestingly, right above the heart. Okay, so that's what lymph is. It's water with stuff in it, shouldn't have a lot of proteins, and it is labeled by definition whenever stuff moves into lymphatic vessels. So let's talk about lymphatic vessels, shall we? The very, very, very tips of our lymphatic vessels are called initial vessels. They are nestled in the interstitium, right? That is the intercellular spaces. And we see in this picture a very nice representation of tissue cells. And the structure of our initial vessels has some similarities with our cardiovascular capillaries, but they're not quite the same. I hope you will remember, and we saw a picture of this, that our cardiovascular capillaries, our blood capillaries, meet each other. There's no opening. If there was an opening in our capillaries, blood would get out, and we call that bleeding. But our lymphatic vessels, remember, they are there to be our vacuum that's picking up all the excess fluid. They are a little bit open-ended. And what we see in this picture, where these light blue arrows are moving into, let's see if I can get my mouse to work. These light blue arrows are moving between these epithelial flaps and into the initial vessel. This represents the movement of interstitial fluid. Out here, interstitial fluid. In here, of course, it's changed its name. Now it's lymph. Another structural thing I want to point out here is that, these flaps allow for some opening. And that means that these initial vessels are incredibly permeable, more permeable than blood capillaries, more permeable than most anything else in terms of tissue tubes. And part of what helps them is that these epithelial flaps are anchored to nearby cells by little collagen filaments. And the collagen filaments, these anchor filaments, are represented in this picture by these green lines. So these anchor filaments are attached to these endothelial cells, and they hold the cells a little bit open to allow fluid to be sucked into that lymphatic capillary. Think about this. These anchor filaments, they are incredibly delicate. They are easily damaged. When we accumulate a lot of fluid between these cells, the first thing that tends to happen is that the anchor filaments, because the cells are being sort of pressed apart from each other, the anchor filaments work really well to hold those flaps more open, which allows us to absorb more of that excess fluid into the lymphatic capillary, which is awesome. But what can happen when edema is too extreme is that they can actually be damaged. And then the capillaries are much less effective, and the edema becomes sort of self-fulfilling. It gets worse and worse because our initial vessels aren't working as well to route excess fluid out of that neighborhood. The next thing that happens from the initial vessels is there's a little valve, a one-way valve that only allows fluid to travel in one direction. And then the fluid that is being sucked in by these initial vessels travels into a slightly thicker, less permeable structure called a pre-collector. Now, if you happen to have a straw handy, and I brought one to help me with my water today. So here's our, one quarter of the lymph that will be sucked into our lymphatic vessels today. I'm just going to take a sip of water with this straw. And again, this is a concept that will be coming up as we go. So we create a vacuum, right, in our mouth and throat that pulls water up the straw. And then when we swallow and we relax that vacuum for a second, our tongue may cover the tip of the straw, and that keeps water in the straw. What I'd like you to imagine is that those one-way valves are behaving like your tongue. So they keep water ready for the next contraction or the next swallow. I hope that makes some sense to you. That's actually an analogy that really works for me. I would like you to think of lymphatic capillaries as sucking up and swallowing interstitial fluid deeper and deeper into the system. here is a picture that shows us this one level up. So we have our initial vessels up here, those tiny little ones with the open-ended flaps. We have our pre-collectors here that are setting us up for valves. And then the pre-collectors send the lymph into slightly larger vessels called our collecting vessels, or sometimes they're just called collectors. These are much thicker. They are structurally really, really similar to veins. So if you think about the veins that you learn with the cardiovascular system, you will recall they have a thin layer of smooth muscle tissue. That smooth muscle tissue contracts and pushes fluid along. And veins also have valves whose purpose is to make sure that that fluid only moves in one direction. And we have similar kinds of valves in our collecting vessels. Our collecting vessels are structurally arranged in these little segments, these little sort of, what kind of shape will we call this? This little sort of teardrop shape segment separated by these valves, and each one of these segments is called an angion. So sometimes you will hear the term lymphangion. What we're talking about are the segments of these collecting vessels. One of the things that the collector vessels do is that we don't find anywhere else in the lymphatic system is they will sometimes collect or connect to each other to make anastomoses. And this is a place where several tubes come together and they create a little closed system, and the fluid can go in either direction. And we're going to come back to this concept, and we will look at a picture of an anastomosis in the lymphatic system. And because this structure becomes extremely important for how our body deals with edema and for how we as manual therapists can influence that. The next bigger vessel, our collectors or collecting vessels, will carry lymph from major areas of the body into larger vessels called lymphatic trunks. It's really hard to find pictures of lymphatic trunks. In this picture, the lymphatic trunks are everything is green. That's part of the lymphatic system. But the trunks are indicated in black text and with black indicators. So here we have the intestinal trunk, the left lumbar trunk, the right lumbar trunk, the right bronchomediastinal trunk, and so on. The trunks drain major body areas. So they are, part of a system that's sort of responsible for a substantial part of the body, like the head or the neck or an extremity or a big part of the thorax. And the trunks are big enough and strong enough, and they also have smooth muscle tissue, that they tend to run alongside arteries, and they may be wrapped in the same fascia along with those arteries, and that will become important for reasons that we will talk about in a little while. The ducts are the largest of the lymphatic vessels, and, we call them the largest. They're not that large, but they're the largest ones we have. There are two major ducts in the body, and again, this brings us back to that odd asymmetrical arrangement that we have with our lymphatic system, but we'll take another look at that in just a moment. The lower half of the body, so the pelvis, the lower part of the abdomen, the lower extremities, plus the upper left quadrant of the body, which includes half of the head and face, half of the neck, and the upper extremity and the thorax, all drain into what becomes the thoracic duct. The base of the thoracic duct, which is on the anterior aspect of the vertebrae, running right next to vena cava and the aorta. The base of the thoracic duct is a little collecting globule, a little collecting goblet, if you like, called the cisterna chyli. Cistern, of course, means collecting area, but chyli, I looked this up, comes from the Greek for animal or plant juice. So the cisterna chyli is collecting lymph from the lower abdomen, the pelvis, and the lower extremities. That's going to work its way up. Remember, all of this is moving against gravity, but if you think about sucking on your straw, it is sucking lymph all the way up. And eventually that thoracic duct dumps into the left subclavian vein here, and I'll give you a name for that junction spot in just a moment. Meanwhile, the right lymphatic duct is collecting everything from the right upper quadrant, the right upper extremity, the arm, the shoulder, the thorax, and of course the right side of the neck and head and face. And that is dumping here into the right lymphatic duct, into the right subclavian vein. Now, every picture you look at about this will usually show you one point of termination. This is called the terminus, where the lymphatic ducts join into the subclavian veins. That's the terminus. The plural of terminus is termini. And so this is where lymph moves from the lymphatic system into the cardiovascular system and changes its name. What does it change its name to? It is now plasma. And that's happening in the left and right subclavian veins right above the heart. This structure here, of course, is the superior vena cava. And from here, we're going to go into the right atrium of the heart. The lymphatic vessels begin very tiny with those initial vessels out there in the tissue cells, and they have the open-ended flaps, and they are sucking up excess interstitial fluid, which changes its name once it gets into the system. Now we call it lymph. The initial vessels send it into the precollectors, where we find the beginning of that valve system, into the collectors, where now we have smooth muscle contraction plus the valves, into the trunks that are draining major areas of the body, finally into the ducts. The ducts dump all that into the termini at the subclavian veins, and the subclavian veins, of course, join together at the superior vena cava, and of course what's left out of this picture is the heart. It's not here because now we're no longer talking about lymph. Now we are talking about plasma. And of course, the other thing that this picture does for us is remind us of this funny asymmetrical arrangement of this whole setup. Our next topic is other lymphatic structures, and specifically the lymphatic nodes. We'll be looking just briefly at some other things, but we need to talk about lymph nodes. Lymph nodes are cleaning stations, and they are located in sort of clusters around the body. We'll talk more about that in just a moment. But here is a cross-section of an inguinal lymph node. The body's biggest lymph nodes are maybe a little less than an inch long. Most of the time they're kind of elongated, they're sort of bean-shaped. And what we see with this cross-section, there's a few observations we can make about this cross-section. One is we have several vessels coming in. These are the afferent lymph vessels carrying lymph into the node. So here we see the valves, and we see that the lymphatic fluid is on this one-way track going into the lymph node. Once we're inside the lymph node, this is where we're going to encounter our filters and our cleaning stations. And this is what's happening in here in the cortex and the medulla. The lymph node is divided into segments called nodules, and the dividing lines are the sinuses. And it turns out that it's quite important to slow the flow of fluid through this lymph node so that it can do its work of filtering out anything that doesn't belong. And one of the most important things it might be filtering out are things like pathogens or dust particles or antigens. Anything that doesn't belong will have a chance. The lymph node will have a chance to pull it out of circulation through the lymphatic system, and then also it's going to sequester it from ever entering the cardiovascular system. Another thing we will notice about the construction of this lymph node is that it only has a couple of efferent vessels. So we have substantially more fluid flowing in and less fluid flowing out. And that tells us something about the pressure inside these lymph nodes. So here's a little bit more information about our lymph nodes. Every person has between 600 and 700 of them, and they don't grow back. If someone's lymph nodes are damaged because of trauma, because of cancer, because of treatment for cancer or diagnostic procedures for cancer, those lymph nodes are gone. They will not grow back. Fortunately, our body is pretty good about accommodating for that, although sometimes it needs some help, and that's, part of what we'll be talking about today. As we've talked about, they filter our fluid and they clean it up. We haven't mentioned, and this class isn't the place for this discussion, but the lymph nodes are also home to many of our really, really important immune system cells. So if this incoming lymph being brought to this node by an afferent vessel happens to be carrying pathogens, maybe on the surface of a macrophage that has marked this pathogen, the macrophage will carry it into the lymph node, and it may stimulate some resident T cells and B cells to launch an adaptive immune system response against that pathogen. Lymph nodes are about 1 to 2 centimeters long. That's a little less than an inch at their biggest. They are covered by a connective tissue capsule. And I think that's really interesting to point out because that also points to the accumulation of pressure inside that lymph node. And they have these sinuses and nodules that are slowing the flow and doing the work of that lymph node. As it turns out, lymph nodes are also arranged in clusters around the body. And that turns out to be really good for making sure that every bit of fluid that finds its way into the lymphatic system has a chance to go through one or more nodes in the process of filtering out anything that we should not be getting back into the circulatory system. So these clusters of lymph nodes, or the lymph node beds, are sometimes called catchments because they catch the incoming fluid. And within any individual lymph node bed or catchment area, we will find both superficial and deep lymph nodes, and the fluid that travels there will have to go through multiple nodes in order to proceed deeper into the system. And if we look particularly here at the legs, we will see that anything coming up from the lower leg is going to have to be filtered by the popliteal nodes, and then again by the inguinal nodes before that any lymphatic fluid makes its way into the thoracic trunk and then back into the cardiovascular system. So the major catchments, and not all of them are shown on this model, but the major catchments are the axillary nodes, the cervical nodes, the inguinal nodes, and the popliteal nodes. This picture shows us the terminus points. That's where the cleaned up lymph fluid is being dropped back into the cardiovascular fluid at the subclavian veins. Interestingly, what this picture doesn't give us is the cervical catchment areas, and that is actually going to be a point of focus for later in this summit. So that's a quick overview of the nodes. You'll be hearing more about these as we go. But we do have other lymphatic tissues in the body. The spleen, which you will, I am sure, recall, is located up here high under the left side of the rib cage. I always have to remember whether it's left or right. The spleen is often described as a great big giant lymph node, and one of the things that it filters is dead red blood cells. So, a big function of the spleen is it is a place where tissue fluid gets cleaned up and dead red blood cells are removed and recycled. If a person happens to lose their spleen, say through trauma or surgery, they are now, they can live. We can live without a spleen, but that person has lost a substantial amount of immune system function, and they are now considered to be immune compromised. There are other less specific clusters of lymphatic tissue that acts as tissue filters to pull out or sequester pathogens and debris, and these would be in our tonsils and adenoids. Our bone marrow is often classified as lymphoid tissue, the thymus gland. We have special patches in the intestines where we have lymphatic tissue called Peyer's patches. And interestingly, the appendix, the vermiform appendix, that little, we used to call it a vestigial organ that hangs off of the cecum of the large intestine, is considered now a reasonably important piece of lymphatic tissue. And one theory about the appendix is that it may house our colonies of healthy bacteria that help us to maintain a functional microbiome in our digestive system. So these are all types of lymphatic structures. So we've done a pretty good job on talking about lymphatic structure, right? We talked about all the different levels of lymphatic vessels, from initial vessels all the way up to the ducts. We talked about how lymph nodes, where they are, what they're made of, what they look like as the fluid flows through them. What I want to do now is talk about lymphatic system function specifically in terms of uptake and flow, because these are not synonymous terms. When we think about uptake, we are back here looking at our initial vessels. This is the sucking of interstitial fluid into the initial vessels where it changes its name from interstitial fluid into lymph. We've talked about the anchor filaments and how they help us to manage edema. And a lot of this relies on fluid dynamics and a concept called obligatory load. And that has to do with how much leftover interstitial fluid there is that the lymphatics have to pick up. They are obliged to pick up and suck in order to maintain healthy levels of interstitial fluid so that we don't develop edema. In the collecting vessels, now we have stopped talking about intake and we are talking about the flow. And this depends on that siphon effect, that sucking effect. That relies on several things, including smooth muscle contraction, which is monitored by the autonomic nervous system. So it's interesting to me that the nervous system that helps us maintain homeostasis is also helping us to maintain appropriate amounts of lymphatic flow. And then we also have these external pumps. We have skeletal muscles that surround and squeeze on lymphatic vessels, the collectors, and even the larger ducts. And there are some special exercises that can target, for instance, movement through the cisterna chyli. You might remember earlier I talked about how the larger collector vessels run alongside arteries and may be wrapped in the same fascia. This becomes really interesting and important because when those arteries pulse, they press and pump on the collector vessels. When we take a deep, full, three-dimensional diaphragmatic breath, we're doing a couple of things. One of the things we're doing is creating a vacuum in the thorax, just like when we suck on a straw. But the other thing we're doing, through the action of the diaphragm and the abdominal contents, is we are physically pressing on the cisterna chyli and the lower part of the thoracic duct. And that also pushes lymph up through and helps the flow of lymph through the system. And then, of course, there's manual therapy, and that will be a point of focus through the rest of today. Watersheds and lymphotomes. A lymphotome is not like a dermatome or a myotome or a sclerotome where we're talking about nerve supply. A lymphotome is an organization of lymphatic capillaries and collectors and chains of nodes that are associated with a particular area of the body. Lymphotomes basically determine the direction of flow of fluid within a certain area. A watershed is where those lymphotomes meet, and the fluid will flow in different directions on either side of that watershed spot. Now, this is where we need to talk about those anastomoses. You might remember, way back at the beginning of our time, I talked about these collector vessels and how there are places in the body where they connect with each other and the fluid in those neighborhoods can go in either direction. This actually allows fluid to cross over watersheds so they can it can move from one lymphotome to another. So one of the things we see in this picture is that this has given us a blockage in this collector vessel. So we're going to have a backup of fluid. It'll go down to the blockage and turn around, find its way through the anastomosis, and then be pulled out of the area through a different lymphotome. And this is the basis behind lymphatic therapies, manual lymphatic drainage, lymph drainage technique, is taking advantage of the fact that this is a system that allows some rerouting of fluid movement and using those anastomoses to do it. So I want to take just a couple of minutes to talk about what happens when things go wrong. And we're going to talk about these things. In lymphangitis, we have a situation where there's an infection that invades that particular lymphotome. So this person probably had an infected hangnail. And if you look carefully, you can see that there's a reddish line that moves from her finger up her hand and all the way up her line, up her arm. And this is telling us, this inflamed area of the lymphatic system that is battling an infection. Lymphangitis is not something we're likely to see on our tables because it hurts and it makes a fever and it makes people get antibiotics. But it is sometimes an occupational hazard for massage therapists when we are not taking good care of hygiene and when we're not taking really good care of our cuticles. So don't let this happen to you because any little cootie can get in and invade the lymphatic system. This is lymphangitis. You may have heard the term lymphadenopathy. This is a very general term for something's wrong with a lymph node. Adeno means gland. So this would be like an enlarged lymph node. And that enlargement could, which we can see here pointed out by these helpful red arrows, that enlarged lymph node might be related to an infection. It might be related to cancer. It might be related to other kinds of problems. Lymphadenopathy is not enough information to make a decision on. We need to know why this lymph node is inflamed because it's usually not great news. There's an infection or there's something quite wrong, say, for instance, like lymphoma. Lymphoma is cancer of the lymph nodes. It comes in different forms. There's Hodgkin's lymphoma and non-Hodgkin's lymphoma, which actually comprises a whole bunch of different types of lymphoma. But basically what we have is cancer cells that are taking over the function of lymph nodes, and this suppresses other healthy activities. Warning signs of lymphoma would include things like painlessly enlarged lymph nodes. That's never a good sign, along with things like night sweats and reduced immunity and weakness and anemia and some other kinds of problems. And then we have edema. And there are gazillions of types of edema. I have chosen to break this discussion into just 3 kinds of edema. We'll talk about edema from organ dysfunction first. This is a picture that is meant to demonstrate the edema associated with heart failure. When the heart can't push enough fluid, then we have pulmonary edema in the lungs, and we have edema throughout the rest of the body. And when fluid accumulates in the belly, we call this ascites. When fluid accumulates in the ankles and the legs, this is another kind of edema. And you can imagine that this is going to put a big strain on the lymphatic system. Other organs that can cause this kind of edema would include things like the liver. The liver is a big keystone for fluid management, especially in the abdomen. So someone with liver dysfunction, cirrhosis, or liver failure is very likely to have especially abdominal edema. The kidneys, when the kidneys fail, when we're not pushing enough urine out of the body, fluid backs up through the body. Kidney failure and heart failure are best buddies. They often go together. So kidneys, liver, and heart are really the organs that are at the center of fluid management for our body. And when they fail or when they don't work well, we are likely to have systemic edema. The edema related to trauma or infection is usually much more localized. This is a picture of someone who shared their sprained ankle. And we can see that their ankle is very puffy. They have some bruising. This is a pretty new one. I think they said in this post that this ankle was the sprain was 3 or 4 days old. Edema related to a musculoskeletal injury like this, it's painful, but and the worst thing that manual therapy might do for it is make it worse and disrupt it before it's really ready to receive any deep work yet. When we have localized edema related to infection, of course, that is more problematic because of the risk of creating lymphangitis or, spreading the infection. Either way, these are edemas that are much, much simpler chemically than lymphedema. Lymphedema is related specifically to damage to the lymphatic system. And for that discussion, I am going to turn things over to Megan Belanger. Thank you so much, Megan.